had a tooth extracted today, so I wanted to make a video and talk about his tooth extraction.
Stella, Splash, Simba, Hydrox, Ditto, and Boo, the Lucky Ferals.
I didn't really film much at the time because it was all, I don't know, it was kind of the spur of the moment. I had no idea that he was going to have a tooth extracted until a few seconds before it happened. So I just wanted to go over some things that have been going on with him lately, some signs and symptoms of a loose tooth, because it ended up that he had a loose tooth. And I just want to talk about his experience today in case you have a cat going through something similar or you notice something similar. So I don't know if you saw that, but there's some blood in his mouth because he had a tooth pulled. I'm just trying to keep it off of my, I don't want him to wipe it on me. I should grab a tissue. I want to do this fast because I just want him to relax and not do anything. And if I'm in the room, he wants to walk around and do stuff. So, Boo, let me wipe your mouth. So a few weeks ago, I noticed Boo had a little bit of drool coming out of his mouth while he was sleeping in a cat tower. It wasn't a lot at all. It was just, I don't know, maybe like a half inch, an inch of drool. But I noticed that, you know, after dealing with a cat that had severe mouth problems, which was Ditto, I keep an eye on things like that. So, you know, it could be a situation where a cat is really comfortable and, you know, sleeping, because some cats drool in their sleep when they're really comfortable. So I just made an observation of it and I said, okay, well, maybe that was the case. And then it happened again a few days or maybe like a week later. And then I made like another observation of it. So that is one of the first signs of a cat having some kind of mouth issue, would be drooling from the mouth. Again, sometimes it's just because they're very relaxed when they're sleeping, but sometimes it can be more than that. The next thing I noticed was it appeared that one of his fangs was longer than the other. Now, Boo has always had long fangs for a cat. As long as I've known him, everyone's like, wow, he has really long fangs. And the last time he went to a vet, which was almost a year ago, the vet said that Boo is long in the tooth and chances are good that he would eventually lose his fang teeth, because that's what happens sometimes with some cats. Now, it can be genetic, or it also could be because he has FIV, and FIV cats are known to have issues with their teeth. So that was duly noted, and that's why when I was looking at Boo one day, I was like, it looks like one of his fangs is longer than the other. I hope it's not a situation where it's starting to fall out. So that was like another mental note that I made. Then what happened was a few nights ago, Boo was laying on my bed and I have like a white comforter, and on top of that I have like a white duvet cover, and we're getting ready for bed, and Boo kind of, it was almost like a sneeze or something, like he shook his head and some kind of liquid came out, and it was not blood, it was not red, but it was like a dark brown color. And I remember thinking, that's odd. I wonder if it's from the wet food that he had, because he's on new wet food recently, like he gets homemade raw food and then he also gets some canned food. And I was like, well, maybe it's the new canned food he's on, because normally it would be more of a clear color or a lighter brown color if it was food. So that made me thinking, well, I hope there's not any kind of like bleeding going on inside of him, because they say that if a cat is bleeding somewhere inside and the blood gets dried up, it'll be like a dark brown or a black color. That's another thing to look out for, any kind of off-color liquid or excretions coming out of the cat. And then I think it was yesterday where I walked into my room and I saw what looked like a hairball had been thrown up on the rug. And then when I cleaned it up, I noticed again it was in a really dark colored liquid, which I was like, well, I hope this isn't dried blood. And then last night when I was getting ready for bed, Boo was laying on my white comforter, and I left the room to brush my teeth, get ready for bed. I came back in the room and Boo was gone, but there was a splatter of blood on the white comforter. Like, not a little bit. I mean, not a crazy amount of blood, but like enough where I was like, oh no, is he sneezing blood? So I was able to isolate him in this room, and he spent the night in this room. And then this morning when I checked on him, there was more blood in the room. There's blood by the window and blood on the blankets, at which case I was like, okay, he needs to go to a vet. I called his regular vet. They could not take him right away because they had a surgery this morning, but they scheduled me for like 11:15. And I was like, I have my own dental surgery today at 2 p.m. I don't think I'm going to be able to get him to the vet, back from the vet. And, you know, I wanted to make sure I had enough time to do what I needed to do. So I took him to a local animal hospital at 9 a.m. We got in right away. They looked at him right away. They opened his mouth. We looked inside. I mean, it was just filled with blood. His mouth was full of blood. And sure enough, the fang that I said was looking longer than the other one was actually loose, and they wiggled it. And yeah, so they said that's where his blood was coming from. So they pulled the tooth. Like, they literally just grabbed like a pair of pliers and pulled the tooth. Like, in 1 second, the tooth was out of his mouth. They say that's actually the way they deal with something like that, because overall it'll cause him less discomfort and pain than to put him under, or however else you could deal with that, because they said that he's actually in pain because of the tooth being loose and the condition of it, and he's probably been in pain, but he's been acting normal. Like, he's been eating normal, no issues with him not eating. His activity level has been normal, no issues with his activity. Like, he has not been acting strange at all, other than over grooming, but that's due to other things. And I even talked to them about that. I said, could his over grooming have caused these mouth issues? And they said that it's completely unrelated. I don't know how unrelated that could be, because he does groom with his mouth, but they said, like, if his mouth was healthy, if his teeth were healthy, then, you know, he could groom all he wants. It's not going to have a negative effect on the teeth. But if there's an underlying condition there already, if there's a tooth there that's already, you know, somewhat loose, it potentially could aggravate it and make the condition worse. So Boo got his tooth pulled, no anesthesia, no painkiller, nothing. They just pulled it immediately. I guess it's kind of similar to when a child has a loose tooth and the tooth is loose and then you just pop it out. So that was him. They did prescribe him painkillers. He's on gabapentin twice a day and on antibiotics once a day. So he already had his antibiotic today, and he had some painkiller, and I'm just going to wait another few hours before I give him his dinner with some more painkiller. Now, he has been bleeding since he's been home, but they said that should usually stop within 24 hours. They said it should stop by the end of the day. However, I also had a tooth pulled today, and I'm still bleeding from that also. It's been about 3 or 4 hours for me, and I had to have gauze in my mouth to absorb a lot of the blood. So I can understand why Boo's tooth might continue to bleed because he wasn't holding gauze in it. You know, it's not like you could give a cat gauze and say, okay, apply pressure where the tooth was. You can't do that. So there's going to be more bleeding for him than there was for me. Right now, mine has pretty much stopped, which is why I'm able to talk this much and film this video. But for a cat, it's going to be different. So also because Boo is FIV positive, I'm keeping him isolated in this room and away from the other cats. I want to wait until he stops bleeding for a good 24 hours before he reintegrates with the cats. I just want to make sure there's not going to be any blood. And when I came in here, I think as we saw in this video, he was bleeding. There was still some blood, but he's also jumping around. So it could be that when he's jumping, he's aggravating it. Also, he has been trying to groom himself a bit, and that could be aggravating it. So I have been trying to not spend time in this room and just let him rest. I don't think he's even slept today yet, so I don't know if the medicine he's on is affecting his sleep. He didn't really sleep much last night. I looked at the security cameras. He was pretty much out and about in the room. So I would like him to get some really good sleep. But it could be good that he's not sleeping because, you know, they do say that you want to keep the head, you know, a little bit elevated. And it's not like you could tell a cat to use 2 or 3 pillows. It's not going to happen. So he's under observation. He's in the separate room, and that is what is going on with him right now. So if you have a cat who's getting a tooth extracted, or if you have a cat who has a loose tooth, or if you're noticing similar symptoms in your cat, this is the experience that Boo's having, and I just wanted to share it. Obviously, if you're noticing symptoms, get your cat to a vet, have the vet check out their mouth because, you know, why keep the cat in pain if they could have the tooth removed and then the cat will not have that pain. Now, they also told me that I do have to call the regular vet and schedule a follow-up cleanup, like a tooth cleaning where they put the cat under general anesthesia and then clean all the teeth. I left a message with my vet about that, but I don't think it's something we're going to schedule until his mouth is healed from this extraction. So maybe in like a month or 2, we'll do a general cleaning and get that taken care of. So that was Boo's experience today. I find it so crazy and ironic that he had to have his tooth pulled today, the same exact day where I had to have a wisdom tooth pulled. I mean, what are the chances of that? It's like insane. I've never had a tooth pulled in my entire life since I was like a really, really small kid. And then the same exact day I'm having one pulled, Boo ends up having his tooth pulled also. It's so weird. So, yeah, that's the situation. I mean, I'm definitely glad that I noticed him bleeding yesterday versus noticing him bleed today, because that would have been so much worse, because here I am trying to recover from my extraction and then having to rush him to an animal hospital. Like, that would just not be fun. So it was really perfect timing to deal with him first and then deal with myself afterward. And it actually helped me because as I was at the oral surgeon's office getting mine taken care of, I just kept thinking of Boo and, you know, saying, well, he had his removed without any Novocaine, nothing, and they just took it right out and he's fine, he's a trooper, and it just made everything a little bit easier. So good job, Boo. I hope you start feeling better, and I am basically going to keep an observation on him, check on him every so often just to see where we're at as far as the bleeding is concerned, and make sure I clean up any blood in the room, and make sure he's on soft foods. So no crunchies for Boo, only soft foods. I've been giving him his medicine and some churros, which are soft treats, and he'll get some squeeze ups and only soft food. And even now, like going forward, I was just reading a book about how bad dry cat food is for cats' dental health, and how dental disease in cats is just so widespread. I even was talking about that to the vets at the animal hospital, and they were telling me it's so common, especially in cats once they hit the age of 6, 7, or 8. That's when it really starts, and Boo is going to be 8 this year. So they said it's not uncommon for cats. It's something very common. And then when I was like reading this book about how dry cat food could actually contribute to it and make it worse, I was like, yeah, I definitely want to get the cats off the crunchies. Thankfully, they really enjoy those freeze-dried chicken bites, so they could get those as treats instead, and they can have all of the wet cat food they want, and we'll look into other healthy options for them. But that's Boo's experience with his day of tooth extraction, and if you're watching this video, I hope it was helpful for you in some way. Thanks for watching. Bye. Thank you for watching this Lucky Ferals video. If you enjoyed it, please give it a thumbs up. Please subscribe if you'd like me to post more videos, and please make sure to check out these other videos that were selected especially for you.